Lips together, the teeth together, tongue on the roof of the mouth. That was that's the tropic premise that my father came up with. And that's what I built Mewing off. Mewing was derived from the tropic premise with bits I added on. I observe many young children in their first 12 years of development. And that famous 1,000-day period, which is just so vital. And I see them just hanging their mouths open. Yeah, and of course they've had 1, 2, 3 events. Some of those events maybe more than a day with blocked noses. Anyone listening or watching this who has a child, download one of those apps on your phone, put it in their room at night and check to see if they're snoring. Because if they're snoring, you have problems. I see facial form is getting worse, dramatically worse. You know, we see this orthodontic industry. We see this ENT industry. We saw sleep apnea, ADHD. All of these things, they all seem to be going up at exponential rates. Yeah. And all have been treated symptomatically. No one's asking the cause. They're all related to the craniofacial structure. And simply, if something ain't the right shape, it don't work properly. Come on, wake up, smell the coffee.
Zdravo svima, dobrodošli u još jedan Agelast podcast. Ove nedelje imamo jednu posebnu i nešto drugačiju epizodu za vas, ali uskoro ćete čuti o čemu se radi. Pre nego što počnemo, samo se zahvalimo svima vama koji ste zapratili našu YouTube stranicu. Ukoliko to još uvek niste uradili, kliknite to belo dugmence subscribe i pomozite našem kanalu da poraste i da ga vidi što veći broj ljudi. Također, kad već govorimo o tome, ukoliko vam se dopada sadržaj koji pravimo, lajkujte, komentarišite, podelite dalje, pomozite algoritmu da nas favorizuje i da nas također vidi što veći broj ljudi. Uz to, svakako želimo se zahvalimo svima vama koji nas podržavate mesečnim donacijama na Patreonu. Ukoliko želite nas podržati na taj način, kliknite u opis ovog videa, kliknite na Patreon link i tu možete mesečnim donacijama da nas podržite. Ukoliko vam je pak draže da nas podržite nekom jednokratnom donacijom, to možete naravno uraditi preko PayPala, kriptovaluta, sve se nalazi u opisu ili možda ovim super zahvalnostima koje se nalaze u komentarima. Tako da hvala vam puno i na svemu tome. Također želimo se zahvaliti našim partnerima bez kojih također sve ovo ne bi bilo moguće. U pitanju je Volt. Kao što znate, Volt je sajt za kućnu dostavu koji pored restoranskog biznisa vam nudi mnoge druge povoljnosti. Kliknite dakle pauzu, idite u opis ove epizode, kliknite na link Volta, napravite profil tamo sa imenom našeg podcasta Agelast i na prve 4 porudžbine dobijete umanjenje iznosa za 250 dinara po porudžbini. Dakle, svakako dobra ponuda i očekirajte njih, a pored toga želimo naravno se zahvalimo našem partneru iz Mazde. Mazdi dizajn znači mnogo više od pukog stvaranja automobila kojeg je lepo gledati. Japanska filozofija dizajna ne razlikuje oblik od funkcije. Lepota i svrha idu ruku pod ruku, a Mazdu čekirajte također u opisu naše epizode. A naš ovonedeljni gost je dr. Mike Mew koji se bavi ortodoncijom. Ortodoncija je specijalistička grana stomatologije koja se bavi ispravljanjem nepravilnog položaja zuba kao i odnosa vilica u toku rasta i razvoja nakon toga. Bavi se proučavanjem razvojnih poremećaja i svih faktora koji mogu uzrokovati malokluzije. Uključuje dijagnostiku, preventivu i lečenje svih oblika nepravilnosti zuba i okolnih tkiva. Pravilno postavljanje zubi rešit će probleme upale desni i karijesa, jer će biti olakšano čišćenje zuba. Sprečit će propadanje potpornog aparata zuba, a samim tim i gubitak zuba. Pravilan odnos zuba bitan je i za funkciju mišića za žvakanje, kao i viličnog zgloba, to je nešto što smo govorili u epizodi sa doktorom Rankom Rajovićem. Sa pravilno postavljenim zubima povećana je naravno i samopouzdanje pri kontaktu sa ljudima, što je negde nepotrebno govoriti, kako poslovno, tako i privatno. A na nastanak ortodontskih nepravilnosti utiču brojne stvari i brojne loše navike, kao što su sisanje prsta, disanje na usta, sisanje predmeta, stiskanje jezika, a uklanjanjem štetnih navika i upotrebom preventivnih mera možemo zapravo pravovremeno da delujemo i ispravimo i pravilno usmerimo položaj zuba i razvoj vilice. Dakle, to je nešto čime se zapravo dr. Mike Mew bavi. Ali ono gde moram da stavim i upozorenje pre ovog razgovora jeste da je dr. Mike Mew zbog svoje prakse, koja je negde generacijska, jer njegov otac i njegov deda su se također bavili time, vrlo kontroverzna ličnost u Velikoj Britaniji. Među ortodontima, odnosno u svetu ortodoncije institucije u Velikoj Britaniji, tako da u vezi sa time ću ja staviti negde najrelevantnije linkove, odnosno najpoznatije linkove, ne mogu da kažem najrelevantnije, ali najpoznatije linkove kao što su BBC, New York Times i Guardian, koji govore neku drugačiju priču o njemu, pa vas svakako želim da pozovem da ukoliko vam ovaj razgovor bude zanimljiv, protražite malo sami, ispitate pre nego što donesete svoju finalnu odluku. U ovoj epizodi svakako sledeći gost je dr. Mike Mew i ne zaboravite na linkove u pinovanom komentaru. To je to. Dr. Mike Mew.
Morning. How are you?
Good morning, Dr. Mike. You are the first true internet sensation that has come to this podcast.
Okay, thank you. I must admit, I feel a bit of an accidental internet sensation. You know, I was never. I wanted to raise awareness of these issues.
Yeah,
I didn't see mewing coming. I didn't. You
how
know,
could you? How could you?
Yeah.
So many people
but
trying to.
In retrospect, clearly it makes clear, obvious sense. Yeah, because why not?
Yeah, of course. But such a simple technique to spark such a virality on one hand and such a controversy on the other hand.
Yeah.
It's just.
Well, it's upending dogma.
Yeah.
And medicine doesn't like change.
Yeah, of course, but we'll dive into it.
Yeah, of course.
Let's start from the beginning. Tell us a little bit more about you. You're an orthodontist, and you became popular around the world with the famous mewing technique. But it's amazing how much a person can accomplish once they dedicated themselves to one thing and one thing only.
Well,
and you've been passionate about it for generations, it seems.
Yes, I'm the third generation of unbelievable focus.
So let's start this story from the beginning.
Mind-bending focus. My grandfather wasn't so focused, but he awoke the ideas in my father when my father was quite young.
So what did your grandfather do?
There was no such thing as an orthodontist 100 years ago. So he was a dentist with an interest in orthodontics, and he was interested in expansion, widening teeth to make space for the teeth rather than taking teeth out, which was commonplace at the time. He was taught by Harold Chapman, basically around just after the Second World War. First World War. And he then read the book of Weston Price. And so my father was quite young when my grandfather told him about Weston Price and the observation Weston Price made, where Weston Price saw these populations around the world who were undergoing the second epidemiological transition. They were going from being subsistence farming to growing cash crops, and they were changing their lifestyle, and they were going from having, good facial development and well-aligned teeth to poor facial development and crooked teeth. And it seemed to be happening often in a single generation, so it couldn't be genetic. And of course, Weston Price was a wealthy dentist, and he was traveling the world and observing these changes and trying to understand what had caused the changes.
Okay.
He wrote a book, I can't remember the name of it, but by Weston Price, I'm sure we can find it.
Google it.
Yeah, Google Price, we'll find that. Physical degeneration or something. But it was a very interesting book. But of course, it has been criticised for lacking scientific rigour, and I could make criticism of it. But I think the observations he made were very sound. Now, my father can remember where he was in Tunbridge Wells in the car with his father driving when his father brought up this subject. So clearly this had a deep impact on my father. My father hadn't even studied dentistry and then hadn't gone on to go into orthodontics. My father had initially wanted to become a surgeon. He was training to be a surgeon And then my grandfather had a heart attack. So my father took some time off to go and look after his clinic and observed the cases that my grandfather had been treating, which completely contradicted what my father had been taught. So my father was taught that if you widen the dental arches, it just relapses. There's nothing you can do. You've got to take teeth out. That's, the answer to everything. And my father...
You're talking about the wisdom tooth or...
No, we're talking about premolars here. Oh. So we're talking about, we almost, what has happened in the world that we consider wisdom teeth to be extra teeth. That's a subject in itself we could talk about.
Yeah.
But we're, in addition to taking out wisdom teeth, we're often taking out premolar teeth, tooth number 4. We often, the Australian phrase, 4 falls on the floor.
Oh, okay.
So my father observed that my grandfather had been expanding dental arches, and my father expected these to have relapsed as he was taught, and he observed this wasn't happening. Some of the cases it did happen, some of the cases it didn't happen, and in a very few number of cases, the upper jaw, the upper dental arch, actually got a little bit wider. And my father just asked the question, why? This was something that was instilled in him by his father, my grandfather, just to ask the question, why? And I've tried to instill this in my children, sometimes to my detriment.
Yeah.
But it's an important thing, and I think that the question why isn't asked enough in medicine frequently, and it certainly hasn't been asked enough in orthodontics. I've had a campaign where I've tried to force my profession into a debate on the etiology of malocclusion, so the cause of crooked teeth.
Okay.
From 2009, with an article, The Black Swan, in the British Dental Journal, I started pushing the profession. I challenged my profession to a debate on why teeth are crooked. And then I started a 6-7 year letter writing campaign. I asked everyone, the all-party dental committee, the Minister of Health. I had a question asked in the House of Lords. I did due diligence. I said, look, my profession, my speciality, the orthodontic speciality, we openly admit that we don't know the cause of the problem we're treating.
Yeah, okay,
now,
yeah, well...
we need to look into this. And I've had a little pushback, should we say.
A little, yeah.
But
a euphemism.
That's a euphemism. So anyway, my father then, stimulated by these observations of the treatment my grandfather had been doing, just played around. He thought logically. He didn't return to surgery. He stayed in the clinic, my grandfather's clinic. My grandfather, unfortunately, passed away at a relatively young age, in his 60s. So my father took over the clinic. He started trying different things. And of course, at the time, he started studying orthodontics, he was very much part of the establishment. But progressively, he started asking more and more difficult questions.
Okay.
And he's progressively got more and more pushback because people didn't like the direction in which he was going.
Okay.
And he went from being part of the establishment, from being the ultimate anti-establishment figure.
Okay. So I want to just circle back, trace back a few steps. First of all, you said that making the upper arch wider. After making the upper arch wider, the traditional orthodontists would think that after that would just relapse.
Yeah.
What does it mean? What does it mean widening it? And what does it mean relapsing?
Right. Okay. So let me first of all point out that there's been a pendulum on this concept.
Okay.
So my grandfather was taught by Harold Chapman my grandfather had done a year of training when he signed up for the First World War. He went and got shot up rather quite quickly in the First World War. So then returned, and once he'd recovered, finished his training with a big metal pin in his leg. And so that would have been just after the First World War that Harold Chapman taught him. And Harold Chapman said that if you are 4 to 5 years old, child, and you didn't have space for a half crown, which is a British coin at the time, which is about 2 millimeters thick. In fact, it's exactly 2 millimeters thick. If you didn't have space for a half crown between all the upper incisors. So that would be in 3 places. So we're talking 6 millimeters of spare space. If you didn't have that much space between your upper incisors at 4 to 5 years old, then you would have problems in the future.
Okay.
So they would advertise a burst of widening at that point in life. So it's considered very early treatment. But Harold Chapman is credited with starting the orthodontic profession down the road of science. I mean, the British Orthodontic Society has the Harold Chapman Prize every year. So he's heralded as being the orthodontist that pushed orthodontics in the direction of science. So he's highly respected, highly regarded. This is a mainstream character, mainstream orthodontics. And in the 1920s, that was absolute standard science. Now, my father then trained, so he was, and where was he? He was 17, 18 to when the Second World War finished. So he'd have been, late 40s, early 50s, he'd be training as an orthodontist, a dentist, and he was taught that expansion doesn't work. So in that 25, 30-year period, the pendulum had swung from you would just widen teeth to widen the dental arch, the top jaw, you would put a brace in and widen the jaws.
So you would put braces.
You put a plate in the top arch with a screw device in the middle of it. So if you've got the upper right teeth, you've got the upper left teeth, you would just push these sideways. Of course, this has quite a few functions. Not only does it make more space for the teeth, it makes more space for the tongue to go on the roof of the mouth. But of course, above the roof of the mouth is the nasal cavity. So, of course, particularly in young children, it was quite well accepted that that's going to widen the nasal cavity and help with the upper airway. If you have upper nasal resistance syndrome, widening the upper airway is certainly going to help reduce that. And we would imagine that if you get blocked noses and allergies frequently, that would help assist your breathing. So the widening of the airway was a really common thing in the 20s. It was a really uncommon thing in the late 40s and the 50s. It then became a really common thing in the late 80s, early 90s. And I think it's possibly going back out of fashion. Well, it's a more mixed scenario now. I think that there's a greater spectrum of different treatments being done at this moment in time. But we've had this pendulum going backward and forward over different time eras, where at one moment you take teeth out and at the one moment you widen the jaws.
Okay, so why would the pendulum swing? Why would people change it? Because everything that you have mentioned so far just made perfect sense. I'm not an expert, so
yes,
but it just makes sense.
I apparently am an expert. I've got the qualifications from the best universities in the world, and still there's so much I don't know.
Yeah,
I personally think what I've observed in my time in orthodontics is that every 10 to 20 years, people realize that we've got problems.
Okay.
They say, well, let's find a new way of doing that. And we set off in a slightly new direction. And no one stops to think, well, we've been here before. And that's why. So I went to study my orthodontic specialization. So I studied my dentistry in the Royal London Dental Hospital, which is one of the top dental hospitals.
Then you
in
went
the
to
UK.
Denmark, right?
Well, then I did 10 years because I had an inkling. I'd had this life plan. And my life plan was to go into orthodontics. But I didn't want to do that too early because I knew it would be tough. So I wanted to go and piss it up a little bit. So I had some time. I worked in Pentonville Prison. I worked on the Outer Hebrides. I traveled the world. I worked in South Africa. I went. I was a dentist going into some of the hospitals in Baragwanath, in some of the townships, and I did surgery in Hillbrow Howe, Joburg General. I taught a little bit restorative dentistry in Witwatersrand University in Johannesburg. So I got this interesting mix, and that was fascinating because I was seeing these, South Africa, you had this first world medicine in a mixed first and third world country. Developing and developed world country. So you saw these people coming in from the countryside who just had fantastic facial development. And then I went on to work, I worked in Australia, so for a period of time I was the flying dentist. We didn't actually do that much flying, but I did fly into a few sort of the Aboriginal communities. And again, it gave me this real interesting observation of how people in more traditional, I don't want to say word primitive because, you know, it's prejudicial, but definitely more traditional lifestyles, they had less problems. They had straighter teeth. They had better facial development. And yet you could see their direct, full-blooded children were having real problems without space for wisdom teeth, with crooked teeth often requiring more than just wisdom teeth to be extracted. So, you know, I knew what my father had taught me. I was on this mission. I wanted to become an orthodontist. I wanted to make sure that I'd got that. I didn't want to have to go into what has become a battle, which I imagined it would be tough work before I'd seen the world and run around and had some fun. So I had a good time as a dentist. It was a good qualification to travel with, particularly if you had a British qualification, because I could work in South Africa. I could work in Australia, and I could have a decent job, making decent income, and I could work for 3 months, then go traveling for a period. And, you know, I bought a motorbike in Darwin, Australia. I drove it down the centre of Australia, through Alice Springs, down to Adelaide, round to Melbourne, up to Sydney. You know, I had fun.
How many years you did that?
That trip with South Africa, Australia, a bit of America and home was a year trip.
Year trip. And then you came back?
Then I came back and immediately started applying to get into orthodontic positions. Mm-hmm. And I looked at the British universities, but I always struggle. Britain is a very conformist country. We queue. We queue very well. We're a conformist country. And I just took the informed decision to go to Denmark. And, you know, Denmark, I went to Aarhus, which is considered one of the top 5 orthodontic establishments, teaching facilities in the world, and almost certainly the top for growth and development of the craniofacial structure. This is where Arne Bjork did his famous research. You know, he took some young, growing individuals. He put little metallic implants embedded in their skulls. He took X-rays every year, and he could, by plotting the little metallic implants he'd placed in their skulls, taking an X-ray every year, he could really get a handle on how they were growing in a way we hadn't before that, and you could never do this research again. You know, I believe some of the candidates were suing the university at the time I was there, because clearly they were relating all of their illnesses and problems to the work, the X-rays he had done, for no greater reason than just observing them, seeing how they grew, how those bones moved. Because, you know, science it's brilliant. Don't underrate it. Yes, I think we've got problems within my speciality of understanding, but I think it's through science, through the scientific process, that we're going to gain understanding and, I hope, prevention.
Yeah, so there's a couple of really just on the nose questions, follow-up questions.
Yeah.
First of them is, so you asked around, you've seen it yourself within one generation, and what is the answer? Why are the teeth crooked?
Okay, well, let's just
why the teeth are crooked.
Just put in your mind this guy that walks off the African Serengeti. You know, beautiful facial architecture, a big, broad smile. You know, showing all 32 teeth. You know, wisdom teeth in place, 1 or 2 centimeters of spare space behind the wisdom teeth. Yeah, not just him, the whole family, the cousins, the uncles, the aunts, the grandchildren, the grandparents, all with this fantastic facial structure. Now, I know, because we've got skull records, that your ancestors, my ancestors, all of our ancestors looked very, very similar. More similar then than they do now. Now, something's changed. And the 3 factors, there's 3 main factors, we think. The first factor is we've gone from this incredibly rough, tough, hard diet. That, you know, I've got strong jaw muscles.
Yeah.
You know, and
you practiced it?
I chew. I love chewing gum. Yeah. So we've gone from this really tough, rough, hard diet to this really soft, diet. I could go down to Starbucks. I could get a white cafe mocha. I could take in several hundred calories with zero masticatory effort. Now, in the past, you couldn't do that. If you wanted to gain calories, you needed to chew. It's often said that we all swallow processed food.
Yeah.
You either have that processed by machine or you use your inbuilt processing unit. Now, I simply put, I've got a big processing unit. And why have I got a big processing unit? Because I use it. You see these bodybuilders, they've got big bodies because they use them.
Yeah.
If you use part of your body, it will become well developed.
Well, and some of it is growth hormone. With bodybuilders.
Hey, it's not for me to judge or decide.
You widen your face, and it's strong as it makes your jaw
Yeah,
muscles
I mean,
stronger.
yeah. I mean,
using steroids also do that.
Well,
does that.
yeah, that's outside. I mean,
But they do eat like 6 meals a day.
Fine. That's not. It's not my. I'm fascinated with this area. As we go to trying to understand correction, I want to leave no stone unturned in my quest to help people. And I think those are some interesting avenues you bring up there, and how we could help people. But there's a simple thing. You can see the wear on ancestral teeth, and you see the wear on modern teeth, and there's this massive change in the level of wear. And it comes down to a simple: use it or lose it. Yeah. And we're not using the system, it's not developing as well. Now, that's one. I think that's possibly the most important factor, the use it or lose it factor. The second most important factor is oral posture.
Oral posture.
Oral posture.
What is that?
You see that guy off the African Serengeti, he's standing up, absolutely. Now you're standing up, aren't you? Yeah, I was sitting up. So
not slouching.
Not
in this
slouching, exactly. And what are we doing in the modern society?
We slouch.
We're slouching. Yeah? But if you guy walking off the African Serengeti, standing up, beautiful body posture, absolutely a serene level of body posture. Now, breathing through his nose with his tongue on the roof of the mouth, with the lips and teeth contacting. Well, the teeth near or actually contacting. Now, that is ideal posture. If you've got that posture, you will grow well.
Wait a second. Did you just said resting tongue on the roof of your mouth?
Yeah. So teeth, lips together, teeth together, tongue on the roof of the mouth. That was that's the tropic premise that my father came up with, and that's what I built mewing off. Mewing was derived from the tropic premise with bits I added on. Teeth, when we say contacting, it should be in or near contacting with the tongue on the roof of the mouth, acting as the antagonist to you biting together. So you're not going to clench if your teeth are together, if the tongue's on the roof of the mouth. That's an important point. Wow. To the people who criticize me for suggesting you bring your teeth together.
Well, I'm just thinking of it when I'm resting, when I'm like, when my teeth are together, my lips are together, and when I'm resting, just putting zero effort. Yeah, my tongue is touching the upper.
Yeah. The really important part, and the really one I introduced, and it's sort of, God, a lot of these, I say I have a very lucky life. Many ways, things have just happened to me. And I think, there's an old phrase, you put good stuff out, good stuff comes back. And what I really identified, and one of the core bits of mewing, was this identification of the back third of the tongue. And that's the really difficult bit, which I can't get across to people very easily.
Back third of the tongue.
So the back third of the top, the dorsal surface, the back third. We'll come to that, because we need to finish that, the cause.
Okay.
First. Cause is important. If you don't know the cause, you don't understand the problem. And that's my main criticism of modern orthodontics, because medicine is supposed to be about treating the cause of the problem, okay?
Yeah.
And hopefully prevention.
Okay.
Right, so the other thing is blocked noses. So if you've got with the idea, the tropic premise, lips together, teeth together, tongue on the roof of the mouth. Well, if you get a blocked nose, what you're going to do? Because you've got two options here. You pack up your bags and die.
Yeah.
Or you're going to lower your tongue, and open your mouth,
and let the air
separate the teeth, and let the air in. Yeah, exactly. You become a mouth breather.
Yeah.
That's become a derogatory term now, hasn't it?
Yeah.
Yeah. And it's interesting how...
And it's being very derogative for many years now.
Well, I hate to say how wound up I am. I see mouth breathing and mewing, these two things seem to be very synonymous with each other. Now, I think that, for the duration of having a blocked nose, you have got to mouth breathe. Yeah, no question. But after your nose clears, you may or may not correct your posture.
Okay.
So your tongue might go
your
up.
oral posture.
Exactly, yeah. Oral. You remember, we've got to separate, because oral posture and body posture are linked, but in some ways they're also separate. So what happens, though, is I think that, I observe many young children in their first 12 years of development, and that famous 1,000-day period, which is just so vital. And I see them just hanging their mouths open. Yeah, and of course they've had 1, 2, 3 events. Some of those events maybe more than a day with blocked noses. Now, I'm not. It's not my area. Allergies isn't really my area, but we know allergies are going up at a crazy level. I mean, just for example, where were nut allergies? When I was a kid, I had never heard of a nut allergy, and I mean, when I was a kid, I was the asthmatic. I was the child in, I think most of the school, there was 2 asthmatics in the school. How many asthmatics are in most schools now? How many asthmatics are in most classes now? In the UK, it seems that, 20 to 30% of the children are asthmatic.
Really, that much?
So I hear, don't quote me.
Okay.
But it seems to be, we have this tide of pharmacy where every morning these kids wander in, they're carrying a pharmacy with them. And then you go back and they carry a pharmacy home with them. There is a lot of change. We've changed. There's been change. Anyway, if you can't breathe out your nose, an open mouth posture becomes a habit. Whether or not you continue to breathe out the nose or the mouth, I think where the air goes is less important than where the tongue, lips, and teeth are. But effectively, if you're hanging your mouth open and you've got weak muscles from the soft modern food, well, I'm suggesting your face then lengthens. If you've seen someone who has a stroke, one side of the face lengthens. Well, what I'm suggesting is that modern humans have had the equivalent of a bilateral stroke. So more or less evenly, but frequently it's not even, the face has just lengthened. It's dropped down. So what's happened is that it's a little bit like my kids. You've got those sort of rubber heads, dolls, and if you stretch the head and it makes the head longer, the head will become narrower and shallower because the volume will maintain the same.
Yeah.
So the cross-sectional area reduces. As the cross-sectional area reduces, as a face becomes longer, you have less space for the teeth.
Yeah.
Hence, less space for wisdom teeth, and then potentially less space for a premolar, 4 fours on the floor.
Okay.
But also, you have less space for the tongue, but most importantly, you have less space for the airway. Because at the end of the day, pretty teeth, all fair and well, but it's sleep apnea, there's a big worry. And then, to open your airway, you move your head forwards. That's going to throw your body posture off. That's going to give you a forward head posture. That may well give you anterior pelvic tilt. That may well give you some body asymmetry. Where the scoliosis and a downswing in facial form, which is what I'm describing, start and finish. Because when things go wrong, things tend to go wrong asymmetrically.
Yeah, well, I'm glad you mentioned it because we had a guest here, I don't know, a few months ago, a neuroscientist. His name is Professor Dr. Ranko Rajovic, and he is specialized in development of the children. Yeah, development of children. And he said that, for example, if you have one baby tooth taken out because of, I don't know, some, because
of decay or
something. Yeah. So one baby tooth pulled out. I'm gonna butcher this, but I'm gonna try my best.
Give me the essence.
So you're gonna have you're gonna develop a habit of chewing on the stronger side where you have all the teeth, which is gonna give you some asymmetry.
Yeah.
But you putting that aside, like you're gonna have, because this mandibula, right, the lower jaw is the strongest one. The way I forgot how he mentioned it, but it's something going to happen with the way you chew food, with the way you develop your neck muscles, which are going to influence the posture and development of the spine, which can end up in scoliosis.
Yeah, but they've done this with rats. They build a block almost.
And we got a lot of heat for that. for that segment.
Well, fine, but you've done it with rats. You know, what they do is they build a big piece of a filling material. They put it on one side of the mouth, between the teeth, so they become asymmetric in their biting pattern, and you get distorted craniofacial structure, you get distorted upper spinal structure. Yeah, done. Science. Thank you very much. Don't give me a hassle. Look at the science.
Yeah. So that's...
But what often happens, actually, just to give a little detail on there, in the period of time before they lose the tooth, often the tooth is painful to bite on. So you get a neuroproprioceptive response.
Yeah.
Where they just don't want to chew on one side of the mouth. They favor another side. And of course, you've overlaid on the fact, you know...
We've all been there. We've all been there.
Well, yeah, but then overlaid on top of this is this tendency for the face to be downswinging. Yeah. So, you know, this is, I mean, it's a really sensitive subject here because what I'm talking about is your face. Yeah? You know, that image you look, you know, what looks back at you from any mirror in the world. If I look at your ID... Which bit do I look at? The colour of your eyes, your height? No, I look at a photo. That, in many ways, that is you. And I'm saying it's morphing, it's plastic, it's changing. Worse, again, if I say your child's face is not growing properly, and to some reason it's your fault.
Yeah.
You know, it's a really difficult message. I'm sorry. I apologise in advance for everything I'm saying.
Yeah.
All I want to do is I want to find answers because my goal here is to make people healthy. Okay? Yeah. Now, if I'm going to make people healthy, then we need to understand the topic. But what I really want is prevention because I really want to prevent these things. I just want to finish off the third thing. I talked about the strength of the muscles. I talked about the oral posture. And the third thing is, you know, things like breastfeeding, prolonged breastfeeding. I think I like have you heard of the baby-led weaning? Where we introduce, so the idea with baby-led weaning is that there was a distinct lack of food processors a couple of thousand years ago. You know, if you were 10,000 years ago and you wanted to blend your food in a food processor and give it to your child through a straw, you were going to have problems. Now, parents did do a little bit of pre-chewing, but I think that they would have limited time to pre-chew everything before they gave it their child. So you had this long crossover period. I mean, breastfeeding, we think, went for about 2 to 3 years. But babies would probably start putting things in their mouths at about 6 to 9 months. I mean, every child, if anyone's ever had a child, you know, they pick things up and start putting them in their mouths. Now, the human, I don't think there's been really any significant genetic evolution in the last 10,000 years. I mean, we've had a glucose tolerance, we've had alcohol dehydrogenase, great, and we can see that in the picture, and you know we've had some the transfer of sickle cell anemia because that was beneficial with
malaria.
So we've seen those, but those are fairly minor. I mean, we've not got an extra finger on our hands. We've not got extra
that would be
teeth.
major.
That would be fair. That would be structurally major. You know, the fact that we've evolved out of having wisdom teeth. I mean, if you think we're losing wisdom teeth because of some environmental change, you don't understand evolution. You know, if you make that statement, please go back, have a little look, and understand what evolution was about, because you are wrong. We have not evolved not to need wisdom teeth. That is just that's bastardization. That's using anyway. I won't go into it. It just annoys me that because you know we're covering up what such an important story here. Okay, so what we think was happening was children would be given sort of sticks of tough meat. We think, you know, the hunter-gatherer era, you know, these really important calories were coming from meat. And when you made a kill, you would clearly probably have some raw meat at the time. But then if you weren't going to make a kill again for several months, possibly, you would, as quickly as possible, dry all the meat. And if you didn't have a kill for several months, then by the time you got the next kill, you were eating little bits of leather. I mean, I met 2 separate anthropologists. Both of them told me stories of being literally almost unable to eat a single mouthful of food offered to them by some of the indigenous peoples they were studying and working with, because they just couldn't do it. You know, they were given this strip of meat. Well, it presumed it was meat. It looked like leather, and this
Dried meat.
Just,
yeah.
you know, this is something
Like beef jerkies.
like beef jerky, but you know these guys don't have a machine that does it perfectly. You know, they've just hung it up.
You just have to chew it,
and you know you chew it. And one of his anthropologists said to me, he couldn't take a bite out of this thing, and he watched this guy just slice it, just sat there in between conversation, just slice, ripping through this stuff.
Has anyone measured the power of the bite?
Yeah,
it would be interesting to see.
Dan Lieberman did do some good work on this, actually. Dan Lieberman's got some great stuff to say. I think that I would love to engage with him on some of those subjects because we share so much. I have talked.
So what would be the difference between average, I don't know, European bite strength against, I don't know, some indigenous people?
Oh, I hate to think. I mean, we've got. I did. We're going up 220, maybe the low 300 kilograms between your back teeth, and that's a big bite. Well over your body weight often. It would be interesting. But I think also it was the lateral forces these guys could put on, because not just the masseters and the temporal muscles,
but also
got your
the grinding.
Yeah, you've got your lateral pterygoids in there, and I mean, I had a discussion with someone recently about the fact that people in the Western Outer Hebrides, where interestingly I'd worked, were eating a lot of porridge, or people in South Africa eating a lot of mealie, and I think when otherwise other conditions were very good, a lot of these ancient foods, they didn't appear to be so tough. But often, even when you're looking at these porridgey things, the last millimetre or two of biting, you've got quite grainy, granular stuff that you need to process in this like millstone action. And a lot of lateral grinding motion would have had to go on to process this stuff down. But of course, you didn't have any of those easy calories. I go back to that.
So you would have to do this all day long.
Yeah. You didn't have the cafe mocha. You have that white cafe mocha. I checked this out at Starbucks. I think it was way, what was the 340 calories? Crumbs, that's a lot of calories you're getting on board. If you're going to take those calories on board, either you will eat less or you're going to get overweight.
Yeah.
Now, we can make comments on both of those. Yeah. But if you're going to eat less, then you're going to take less chewing.
Yeah.
And so all those easy calories negates a tough calorie. And I've this thing called the Mew index. The Mew index is how hard it is to chew something versus how many calories you get from that substance. The classic we quote is celery. Apparently that you gain less calories back from eating celery than you expend chewing it. So there we go. That's a great Mew factor.
Yeah. And also
sugar. Sugar is the lowest Mew factor possible.
Yeah. Processed sugars.
Yeah. We're eating more and more processed foods. So again, I've got a good processing unit because I've used this processing unit.
And you choose what you eat.
And you chew what you eat.
You chew and choose.
Choose and chew.
Choose and chew. Choose and chew. Yeah.
Choose and chew.
Choose and chew sounds like a catchphrase for for some simple life rules. Why is all of this important? Actually, So
okay. Well, the basic problem is that we seem to have a lot of problems from the face. Okay. So what I'm saying is that a face that's the correct, the ideal structure, works well. Now, what we're seeing is an almost exponential increase in things like ENT problems, like
what problems?
Ear, nose, and throat. So
ear, nose, and throat. Okay,
America, you call this otolaryngology.
Yeah, otolaryngology.
Yeah, I always struggle with that term. My tongue can't move fast enough. I think.
How do you say ear, nose, and tongue?
Ear, nose, and throat. Ear, nose, and throat.
Ear, nose, and throat, yeah.
So we're seeing,
ENT.
When you talk to ENT surgeons about the causes, they look about as blank as orthodontists do.
Really?
Yeah, they don't even think of it.
How come? It doesn't...
I don't know. I mean, I just find that when I talk to orthodontists and I say, well, about the cause, and they just... I've got the top orthodontist in the United Kingdom. I don't want to start naming names, but he has a very popular blog. He's retired now from one of the major teaching schools in the north of England in orthodontics. And, You know, I had him saying on a blog that, well, we don't really need to know what the cause was.
Wow. Wow.
It staggers me, you know, particularly considering the action against me at the moment by people who think they know everything. If you don't know the cause, you really don't know the problem. But, you know, we're seeing this staggering increase in, you know, glue ear. We're seeing deviated nasal septums, sinusitis, upper airway resistance syndrome, but of course the biggie, which is sleep apnea. And then, of course, we've got jaw joint problems. We've got forward head posture, scoliosis, I think. But I don't want to go too far down scoliosis because we're opening, you know. As I said, I think I've opened Pandora's box.
Yeah.
And we've spied another universe in there. And there are a lot of people trying to close that box because it forces change. It forces a whole rethink. And of course, you know, mewing is just you know, it's just a shadow of it. It's just an essence of what I'm saying. You know, you know, don't underestimate the amount that's going on here. And I can understand the mewing phenomena. It makes sense, but there is so much more going on here. And of course, the other thing with this breathing and change in craniofacial structure is the amount of facial pain going on. But of course, these ADHDs, these spectral disorders, well, you've got some people who are saying, all right, well, maybe an element of this is kids not sleeping properly. You know, they did some research in Chicago on sleep-depriving children. I mean, it was a tough bit of research. It wasn't easy to get permission to do this research. But
when was this? What's the name of the research?
I think it was Professor Stephen Sheldon was involved, and I can't remember what the research was for, to be honest. But the researcher phoned him up and said, look, never, ever ask me to do this again. And Stephen Sheldon looked into it deeper, and he goes, look, I had a room full of sleep-deprived kids. I never want to be in a room with kids like that again. And apparently these kids were acting just like kids with ADHD. And if you've got a normal child that doesn't have ADHD and you sleep-deprive them, how do they act? Just like a kid with ADHD. And then what do we give kids with ADHD?
Medicine.
What medicine do we give them?
Yeah,
we give them amphetamines.
Amphetamines, yeah.
Uppers. Yeah?
Yeah.
So that's what
I don't know how much is common. I don't know how much of that is common here because I don't think we.
Yeah, but then
we
why?
don't have such a big practice of giving children.
Yeah. But why?
Like in Western countries.
Why?
I don't know why.
Well, you've got better craniofacial structure because you have tougher food. You haven't gone down that line of processed food as much, in my humble opinion. Yeah. Now, I think.
Well, you've been here for a few days.
Well, yeah.
You've seen people around.
Yeah, and they're better facial form. They are. They stand better. They're slimmer. They have better craniofacial structure because they're having less processed food. Now, I'm not saying this is the be-all and end-all. I'm not saying this is the cause of ADHD, spectral disorders, autism, Asperger. I don't think that. But I do think there's an element of this.
Correlation.
Okay? I think there's a correlation that needs better examination. And that's why, when I'm talking about... So let's go to the subject of sleep apnea, because I just want to contrast mewing and sleep apnea. Mewing, there's an internet craze for kids wanting to make the face look pretty. Wowie. Oh, just brushed under the carpet. Who cares? Here's another craze. What's the next craze going to be? And then the craze after that. You could dismiss mewing as a load of nonsense. Just kids having fun. Well, what about sleep apnea? Because sleep apnea was not in my syllabus. When I studied dentistry at the Royal London Hospital, I qualified in 93. Sleep apnea wasn't in the syllabus.
Wow.
I know it wasn't because we use the term sleep apnea as related to left side cardiac failure. And this word sleep apnea was there in the syllabus, but it was related to something else. So I would have recognized if that term was used for sleep apnea. So I know it wasn't in the syllabus. I talked to an ENT surgeon, one of his ear, nose and throat surgeons, a couple of years ago. And he estimated that sleep apnea was killing 10% of people over 60 10 years early. Or sleep apnea is the consequences, because the sleep apnea doesn't necessarily kill you, but it makes you sleepy, it decreases your quality of life, and it gives you cardiovascular problems. We think it's related to most chronic illnesses. So Asperger, not what's it? That degenerative disease. My mind's gone. Early degenerative
dementia.
Dementia's disease. It's related to, but it just stresses the body. Broken sleep. How do you feel? Because also, there's an interesting point of, do obese people gain sleep apnea, or do people with sleep apnea become obese? Because you could, with the science, argue both cases. So, if you've had a really bad night's sleep, what do you want to eat the next day? You want to eat all of those foods that make you obese.
Yeah.
You want to binge.
Comfort food.
Why? Comfort. Because you need comfort.
Yeah.
You've had a stressful event. Yeah? The stress is also, modern stress. But then, so much in medicine's interrelated. You can't pull it apart. What I think I've gone down is I've opened Pandora's box on a whole area of medicine we have just never thought of before.
Yeah.
We've just never looked at faces and thought, oh, that face didn't grow well.
Yeah, and so many people also sleep with, open mouth,
Well, if your child is snoring, please, and it's very easy, you can get one of those apps, put it on your phone. I think Sleep Lab is one of them.
Yeah.
Put it on your phone. Anyone listening or watching this who has a child, download one of those apps on your phone, put it in their room at night and check to see if they're snoring. Because if they're snoring, you have problems. Yeah? Look at the book, Don't Ignore the Snore. Yeah? Great book. Don't ignore the snore. And look at the related problems. You've got problems. Don't put a video of your child snoring on YouTube and laugh about it.
Yeah. Yeah. So what kind of problems?
Well, okay. I worry, these are my worries, that if your child is snoring, that's signs of early sleep apnea. They're not getting good oxygen levels at night. That's going to reduce intelligence. It's well shown to reduce intelligence. They did a study in the States where I'm trying to remember the names of all these researchers because I'm terrible with names, it really holds me back. But
good thing we're on internet so people can look it up.
Yeah. I'll see if I can find this one. So they did research where they tested a school for people with sleep apnea. They then identified a group of people with sleep apnea. They then offered treatment. Kind of knowing, this is kind of the sneaky things that researchers do at times. They offer treatment knowing that some people won't take the treatment up. Then that gives you a control group. So they treated the treatment group for sleep apnea. And at the end of a year, they had 10 percentage point IQ higher.
Wow. At the end of the year?
Yeah, you could not, there's no known method of teaching or anything that can gain a 10 percentage point difference in IQ. That is crazy.
Yeah. Well,
that's suggesting the people with snoring, with sleep apnea, were 10 percentage points lower.
Yeah,
and that's a change in life.
Yeah.
That's a lifestyle difference.
That's a completely I've ventured into the breathing techniques. I don't know. Few months ago, a year ago.
You mean like James Nestor's book, Breath?
Yeah, something like that.
I'm in it.
Yeah.
So he came round. He stayed with me. He researched. We had a good chat. People go to me, oh, look at James Nestor's work. And I go, no, he's a journalist. It's not his work. He's reporting on other people's work. He's reporting on my and my father's work. Amongst others.
Yeah, so I started certain breathing techniques every morning and trying to every morning. That's part of my routine now. I'm trying to implement, midday, late night ones, and once you start doing those things after a few weeks, you start noticing difference.
Yeah. Well, you've got to try and embed these into your subconscious.
Yeah,
and that is a hard thing to do, but we can. We learn that. I mean, I'm sure once you used to wet your bed.
You
learn not to.
But it's easier when you're young. It's a lot easier when
you're younger.
Give
me a child till he is 7 and I will give you a man. Okay, or woman, but there's an old Jesuit phrase. And there's a lot of truisms in that.
Yeah.
You know, you're so nearly plastic. Remember, a lot of ancient humans weren't living much beyond their 40th birthday. Yeah, so up to, you know, you've got...
once we start talking about the techniques, we're going to have this conversation about, you know, children against, you know, elderly or middle-aged people, you know, like how much they can change.
This is interesting, you know, the neuroplasticity and how we can do neuroplasticity. And of course, you touched briefly on the subject when you're talking about introducing chemicals like growth hormones and other things. And I think, well, we need to investigate that because there is a lot of people that are going to need help for craniofacial dystrophy. Craniofacial dystrophy is craniofacial. This is a structure we're talking about. Dystrophy. Incorrect tropos growth. So we're getting incorrect growth of the craniofacial structure. Now, in a modern society, that seems to affect almost everyone. Unless you've got a craniofacial structure like those guys walking off the African Serengeti, unless you have all 32 teeth in big, broad arches with space behind your wisdom teeth, then you are, unfortunately, and sorry for saying this, deformed.
Yeah. Well, I got all of 32 teeth.
Cool.
With wisdom ones also.
They're a little bit crooked, I might say. Yeah, you know, I don't think you came out unscathed. But you're in a better situation than many people. But then we've got this. We then go into this thing of form and function.
Well, yes, I did wear apparatus.
Yeah, and you've still got a retainer.
Retainer.
I did. Sneaky, I saw.
Yeah. Well, and each year I'm asking how long I'm supposed to wear this, and each year like you wait a little bit longer. So I've been waiting for 20 years now.
Yeah, and that's so they fixed it, did they?
Yeah.
Because you know, if I had a leak on my ceiling. And I got the builders round, and they said it was fixed. But by the way, every night when it rains, you have to put a tarpaulin over the roof.
Yeah.
I go, what do you mean? And they go, well, just at night, you know, just in case it rains, you put a tarp. I go, well, you haven't fixed it, mate.
Yeah.
It still leaks, doesn't it? So you've still got orthodontics, haven't you?
Yeah.
It's not finished. You have an orthodontic appliance in your mouth.
Yeah.
So was it fixed? No.
Well, no.
Because did they treat any of the causes? We've got the causes. The predominant causes now, because the developmental cause was breastfeeding and early introduction of soft food. Okay, so I didn't need to. The one comment I was going to say, baby-led weaning. If you give children food that's very soft too early, they don't need to move from a suckle to a swallow. And if you intervene and prevent that normal transition, people continue to suckle. Okay. So your bottom lip, I can see that muscle here and here. Yeah. So when you swallow, I'm bad actually. Watch me. But you do this when you swallow. Yeah.
I don't know.
So you're sucking when you swallow. So you will suck your teeth inwards. A perfect swallow is like this.
Like no.
Nothing
movement.
goes. Nothing.
Nothing. Yeah.
Nothing. The pressure of the tongue goes upwards.
No. Yeah.
Nothing happens.
Okay. I understand that.
Now, if you use any of your facial musculature. So that's the facial nerve. If you use any facial musculature when you swallow, then you're sucking inwards. You're not swallowing correctly.
Okay.
And if you see your children using any facial musculature when they swallow, then they're not swallowing. They're sucking inwards. They suck inwards. It's going to make a reduced cross-sectional area. Less space for the teeth, less space for the tongue, less space for the airway. And that airway, that's quite important, isn't it? You know?
Yeah.
What's the most important thing in your life?
Hair.
Anything better than that? You know, you want a Ferrari? No. Ferrari airway.
Clean air.
Well, I'll have my next breath, thanks.
Yeah. Well, I was thinking about it as from the aspect of biodesign of human, which is very interesting.
Well, I was just going to say form and function.
Yeah.
And then you came on to biodesign, you know, form and function.
Form and function, because it's such a weird thing that you have one hole through which you breathe, drink, eat. You know, you do speak everything.
And you used to. Well, if you wanted a pair of moccasins 10,000 years ago, you got some chewing, mate. Or maybe your friend does.
Yeah, and And then you start thinking about, the air intake, which I started thinking about, a few months ago, up to 1 year ago, and how much it means, how much benefits you get from doing this every morning.
Yeah.
And then you start thinking about it, how much air I'm actually taking in during night, and how much of a good night's sleep I'm getting each day.
Have you tried lip taping?
And that's exactly what I was trying to segue to.
Yeah, segue too. Yeah, I spotted that one coming.
Segue to, because I've been listening and reading about lip taping, but haven't really tried it yet.
Okay, I tape my kids up every night.
You do?
Yeah. They literally, I go to kiss them. They come up, tape on. Go to sleep. So Jessica, the
any
oldest
specific
one,
tape or
just you could go and get all these fancy tape. I mean, Patrick McGowan's got this great tape called Myo tape, which is good. If you're listening to this, typically situation is that Guy will be listening to this. He goes home and says to his wife, "Well, we need to tape the kids up." The wife goes, "Not on your Nelly. You're not taping the kids' mouths up. They're going to die." So Patrick McGowan does this tape, which is like it's a rectangle.
Okay.
And because it's elasticated, it pulls the lips together. I actually use it vertically rather than horizontally, but it's great. It's Myo tape, and it reassures parents that the kids can breathe. So there you go. That's your first step in. But I just get cheap. I get micropore.
Okay.
Just normal, everyday micropore by 3M. The 25mm wide, and I just put a little bit across their lips, and they if they want to speak, they just open the mouth. It's not that tough.
Okay, because children at that age, well, I met your children, but because children at that age, they do talk in their sleep a lot.
Yeah, I haven't noticed my kids talking in their sleep, because they do come and sleep in with us occasionally. Yes, too frequently for me, but not that frequently.
Because while children are developing, a few things are happening. Sleepwalking from time to time, not literal sleepwalking, but with some kids also sleepwalking, talking in their sleep. Because they're developing and you're reliving the experiences of the day. And also and also moving around the bed insanely.
Yes, okay.
Just rolling around the bed while sleeping.
I have a hunch that's due to poor airway.
You think?
I think so. I think it's a relationship. I mean, I have this again. I have hunches. So I have hunch that restless leg syndrome and this moving a lot at night can be, and they're not always, because there's so many factors. And of course, it's like, what they talk about. If you have a hammer, you see everything as a nail, and I must be guilty of that. And it goes along with my ethos that ego is the destroyer of science. You've got to cross-question yourself more than you cross-question other people. Remember, Darwin kept a notebook for highlighting things where people disagreed with him or for evidence that disagreed with him, because it is too easy to forget things that disagree with you. If you're a scientist, if you become a true scientist, you need to look at the opposing side frequently. It's too easy to see things from your perspective.
Yep.
However, that said, that I do think that restless leg syndrome and a lot of movement at night is often related to poor airway perfusion at night. So that's my take on it. So just, again, get a device, listen to their airways. And of course, I can see kids' faces. I just look, I know how they're growing, which makes I tell you, when I walk down from my clinic, I walk down to get, the shops, I walk streets, less here, but particularly in the UK, the famous thing, the UK have the most crooked teeth in the world. Why? Where did the Industrial Revolution happen first?
In England. UK, yeah.
Yeah, so why do you think we've got the worst teeth? We're further down the line. Yep. Also, we've got a damp environment, damp, cold environment. We spend a lot of the year shut up inside houses with poor quality air, high level of antigens, more allergies.
Yeah.
So what do you think? Where do you think it's going? Yeah? So we're further down the line. There's nothing genetic in this. I'm a massive environmentalist. I think there's very little genetics between the whole of society.
And this is where you get the pushback.
I just get pushed. I'm changing things. I'm getting a lot of pushback. There's a lot of people want to shut me up. Yeah. Anything they can do to destroy my name, anything, in any direction, in any way, is, I believe, being done.
Okay.
Yeah?
So
they're going to shut me up fast.
So when did you start lip taping your children?
So, I mean, I've learned, and I've learned from my mistakes. The one thing I would have done differently now, well, one of the things I would have done differently now if I could have, is because my main mission, by the way, I would really want to, let's put up that, link underneath, prevent crooked teeth. That's my mission. Hello, prevent crooked teeth. My big mission is we need prevention. Because so my mission is preventing crooked teeth. Sorry, with all of that, I lost the question. Repeat that,
when did you start lip taping your children? And what are and have you seen the results of it?
Yes. So the one I was about to say, well, the one thing I really wish I'd done is made them walk more. Just walk more. So I really wish I'd really got them into walking at a young age, because I think that's vitally important. The other thing I would have done is I would have started lip taping at a much younger age. Child number one, Jessica, I was much, because it was the first child, I got more photographs, I did more things with her because it was first child.
Yeah.
Second child we did less of. Second child started dummy. So she had a dummy in, pacifier they call it.
Pacifier. Yeah.
When I mean dummy, you looked at me blankly. I wasn't saying dummy.
Yeah.
Pacifier. So she had a pacifier in, and I wanted the pacifier.
We say tutsla.
Tutsla.
That's how we say it. Tutsla or duda.
I do.
Yeah.
So I wasn't happy with this.
Yeah.
When we took it out, she suddenly started mouth breathing. In retrospect, I'd have left it in there. But she started mouth breathing, and I didn't, at that moment, start lip taping. And it went a little while. Of course, unfortunately, this was the time when I started this. I'm sure we're going to go into this whole court case thing. And my stress started going through the roof. It really was tough on me. It was tough for several years. And I kind of let the boat drop. I dropped the ball slightly on that. I then got it together, and then by then she was struggling to breathe out of her nose, and so that means then I widened her top jaw. So she was about 4, 5 years old, and
when you started,
then I put a brace in the mouth about 4 and a bit actually, end of 4th year, and I widened the top jaw. Suddenly she could breathe out of her nose, and then I started lip taping her.
Yeah.
Okay. And
so you have to.
But that made. It was seeing that I realized. I really realized, and I've seen some research on it, where they're saying that they think allergies is related to mouth breathing.
Yeah.
Yeah. And they and suddenly her allergies decreased. Her everything. She suddenly her whole skin color came better. She just was so much healthier.
Yeah.
Just from nose breathing and being able to. So during the daytime, her mouth was often open. But all night, every night, she had to nose breathe.
Yeah.
And so I did a little, again, we were talking about...
So just one question. Do you have to first widen your upper arch before you start lip taping?
Just what I was about to say. So we were talking the form and function.
Yeah.
So, yes, I did a little burst. So again, going back to what Harold Chapman said to my grandfather, a burst of expansion at the age of 4 or 5 years old if you didn't have space between the upper front teeth. If you didn't have space. Now, the way Harold Chapman says that, you get the impression that it was a very small minority of the population didn't have space between the upper teeth for a 2 millimeter coin, and that's 6 millimeters of spare upper space. And you look at ancestral material, well, they all had spaces between the teeth. Look at kids now, almost none of them have that much space between their teeth. And that's again, if you're a parent listening, watching, eating this video, if you've got this far in, look at your child. Yeah. If they're between 4 and 5 years old, if they don't have those great big gaps between their front baby teeth, why? What's gone wrong? Because a structure that's not the right form doesn't function well.
Yeah, I'm just thinking about it right now, and my daughter, she has
nice gaps.
Nice gaps in between the upper and teeth. Yeah.
And
front row upper teeth. Yeah, all of
yeah.
them.
And
and she's 5 years old.
Yeah, and a lot of what I'm saying, is stand up straight and shut your mouth.
Yep.
Is that new? Is that a new idea?
It's not a new idea, but it takes
It takes a bit of whipping to get it into shape, doesn't it? It's not
weird. It sounds weird, but it doesn't feel natural. You put a lot of effort in it, and I can do it for 5 minutes. But I'm gonna start slouching.
Yeah, but still, okay. So you might have all 32 teeth in your mouth, right? But you don't have enough width, and your facial complex is not far enough forward for it to be really comfortable.
Yeah.
Okay? Because we are creatures of comfort. You know, the way, you know, now you're sitting up straight, funnily enough.
Yeah.
But we will slouch down to where's comfort. Now, but the whole idea of posture is it's supposed to be comfortable.
Yeah.
And that's why you've got to instill it at a young age. That's why my whole mission is prevention. Because I really believe that simple, cheap, if not free, public health messages could make a substantial difference.
Yeah.
You know, prevent is better.
I don't know
than
what
treat.
it's like. I don't know what it's like today, but when we were kids, you know, our parents would non-stop, you know, reminding us to sit up straight.
Yeah.
And we even had those T-shirts with some elastic bands on the back, which you would like wear. Once you put them, they would, you know, put your shoulders.
Okay, are you doing this for your children?
No,
Why?
I don't know.
Because we've got out. So what I'm saying is,
I wasn't really thinking about it.
I know. So this idea of good body posture, you can see it going back from Confucius to the Victorians. Okay, that's a long period of time. Okay, Confucius was 3,000 years ago. Victorians 150 years ago or less. And body posture was instilled in people. I remember seeing something in the news about some very early film footage of New York, and they showed this footage on the television, and were saying, "God, it wasn't everyone slim."
Yeah.
And I'm going, yeah, but didn't they all stand up straight? And didn't they all have good facial form? You know, just go and look. I remember doing this bit of research I did, was I was looking at beach and 1960s, and you saw these photographs of people on the beach, and again, they were slim, but they stood straight, and they all, not all of them, but nearly all of them had reasonably decent craniofacial form. No?
Yeah.
None of them needed surgery. In fact, we went into the castle just here, you know, in Belgrade, and we were looking at there was an exhibition there on women power, and there was back in the time of Tito, and I was just looking at, you know, all these women standing up and they all had great body posture. They were all slim, and the facial form wasn't all perfect.
Yeah.
None of them needed surgery, though. None of them were in that group they were going to get sleep apnea. None. Now, maybe it was selected, maybe it was biased, but this is the constant theme of what I see. I see facial form is getting worse, dramatically worse. You know, we see this orthodontic industry, we see this ENT industry, we saw sleep apnea, ADHD, all of these things, they all seem to be going up at exponential rates.
Yeah.
And all have been treated symptomatically. No one's asking the cause. They're all related to the craniofacial structure. And simply, if something ain't the right shape, it don't work properly. Come on, wake up, smell the coffee. Yeah?
If you can.
Yeah. And we've got and the exercise, my big exercise. So when are you going to use this structure the most? When's it going to get through a really good workout?
When you chew.
When you're eating.
Yeah.
Right? So I've got an exercise. Yeah? Super secret. Don't tell everyone. Okay? A secret exercise. All right? It's called the mealtime exercise. Okay? So what you do is during the mealtime, it's a situational exercise. Because remember, if you can instill something that's situational, then hopefully that situation will precipitate that exercise forever.
Okay.
Okay? So here it is. Right? Sit up straight, elbows off the table, eat with your mouth shut, keep your lips together, don't speak when you're eating, chew your food properly, look forward as if you're making conversation, and then, once you've chewed your food properly, chin tuck and swallow. Now, I'll tell you a secret. Apart from the chin tuck that I added on, it's not very secret.
Yeah. At all.
At all.
Yeah.
In fact, I'd say that Confucius was saying that.
Yeah.
Victorians were saying that. It's the same thing, isn't it?
When I was a kid, I used to run, track and field, and my trainer would come to me and say, he would repeat this every day when he would see me eating. He would say, drink your food and eat your drink.
Oh, yes. Yes. Good. I like to hear that.
Which actually meant chew your food so much that it becomes liquid.
There was a guy...
And drink your beverage, drink your water so slowly that it's like eating it, sipping it.
Yeah. I try to remember the guy in the UK. There was a movement in the Victorian era. where they would chew their food till it was liquid.
Yeah.
Yeah, and there was a whole movement.
And there's also somebody once told me, how many teeth you have in your mouth, that's how many times you have to chew.
That was an ancient Chinese proverb that
32 times for each
mouth. I don't know if that's absolutely true, but it's not a bad idea. And of course, when I talk to people who, you know, the amount of dietary problems, you know, digestive problems we have today. And I do think there's a word of advice. If you're listening to this and you have any bowel syndrome, well, before you start reaching for medication, how's about chewing your food properly?
Yeah.
You know, I remember when we were being taught biology, my biology teacher was talking about the digestion of starches and carbohydrates. And of course, this is what a lot of people are focused on. Too much carbohydrates, too much starch, too much gluten in diets. And my biology master said, well, we've got salivary amylase in the mouth. We apparently, according to the guy, McDougall, who does the starch solution, but he gives a good argument that we've got 4 times more salivary amylase than the rest of the primates. Why? Now, my biology master said, don't know why we bother, because it's not in your food for long enough for it to have any effect. Think about that. Not amongst the food for long enough. Well, if you followed your trainer's advice and you chewed your food till it was liquid, it would be in the mouth for longer.
Yeah.
And then the food would be smaller particles, so that's going up exponentially. Not only is it in the mouth longer, but the particles are smaller, you've got greater surface area, so you've got an exponential effect. So now salivary amylase is going to be able to digest your carbohydrates to a far, far greater extent before it goes down into the acid of the stomach.
Yeah.
So here maybe, before you reach for medicines, before you book an appointment with your doctor, just chew your food a bit better.
Choose your food a bit better.
Just chew on it.
Try breathing a bit better.
Yeah.
Try using, oral posture a bit better.
Yeah, chew on that one, mate.
Tape your mouth while you're sleeping.
Yeah, these aren't expensive.
And then see if you need a doctor.
yeah, but that's not good for business, is it?
It's not at all.
What am I saying? If I don't want to be critical of my profession, my speciality, but you've got the main criticism is that I've already covered the point that if they're asking you to wear a retainer after the treatment, have they actually corrected the problem? Okay, then I'm suggesting that I don't want to be pointing to. I wasn't here to cause these problems. I wasn't here to damage my specialty. It wasn't my objective. But I'm saying that, we should better prevent it. That's not good for business. Yeah. I'm saying if you don't understand the problem, then you don't understand the pathological process. I'm saying that medicine's supposed to be about treating the cause of the problem. But then the worst one, and this is what my father, he opened this Pandora's box. He was saying that sometimes, I'm not saying all the time, but when you mess around rearranging the deck chairs on the Titanic, straightening the teeth, as I said, rearranging the deck chairs on the Titanic, everyone gets a view of the band, but is the deck moving?
Yeah.
There's bigger problems going on. But while you're doing that, could you be upsetting the underlying problem? Could that be actually lengthening the face, causing a downswing in facial form, making the underlying problem worse? That's the real controversial issue here. So not am I only saying that orthodontics may not be necessary, but I'm saying it may be making the underlying problem worse. Now, you don't get prizes for criticizing your profession.
Of course.
Yeah.
Well, maybe down the line, down the road somewhere.
Yeah. Well, I saw
many years later.
I saw this proverb saying that the people who are going to gain from the change don't yet realize it. Only the people who are going to lose.
Yeah.
But in a way, I'm opening, a huge new avenue. I think that in my viewpoint, there's 3 big issues in healthcare at the moment. There's something to do with the gut biome and bacteria and our relationship with the bacteria. There's this group of bacteria that we've been carrying with us for thousands of years that we're messing with. Yeah, and the repercussions of that. There's the huge lack of exercise from our body and face, which is causing changes in facial form and body form, of which I've opened half the box on.
Yeah.
And of course, there's the psychological impact in the changing of our society and the way the society is. But we're going back to that middle one. I've opened a whole channel on it that people have just never thought of before.
Yeah.
They've just not opened. And I've opened this Pandora's box, and it, you know, it's going to cause change. Medicine doesn't like change.
Yeah. Well, when did you started this journey? You know, when did this all started for you? Once you finished your studies in Denmark, and then you opened your practice,
yeah, I came back in.
You've seen all these problems, and you started addressing them. Mid-90s.
No, so I qualified in 93. I went to orthodontic school in 2001. I qualified as an orthodontist in 2004. I came back immediately, met this Turkish girl, got married, had a wild affair, and we completed that in about 2009, 2010. And it was, I wouldn't say I wouldn't go back on it, but it was, great experience. I loved Istanbul. I had a great time, but I didn't focus on these things.
Yeah.
Okay. So in 2009, I then wrote The Black Swan. My father, I could see how desperate he was. He had come up with his ideas. He started off being within the orthodontic profession, and the more questions he asked, the further back he got pushed in the whole system. And, I watched him at lectures, at conferences. He'd go right up to the front of the conference, and, he was so nice to everyone. And they were so goddamn rude to him. Mm. And they never once just engaged with him. And there is no place within my profession for dissenting voices.
Okay.
There's no, I've never once had, we did, anyone who's interested.
So, and when did you start developing these techniques that you became known for, and which later on led to,
Yeah. Well, but there's really, what I was going to say, it's really well covered. There's a Netflix documentary, Open Wide.
Yeah, I tried to find this, but it's not available here.
No, it's not. If you can use a VPN, which I'm sure you could manage, someone could show you how.
Yeah, of course. We had VPN sponsors, so.
Yeah, good. So if you use that sponsored VPN, you could pretend you're in the US, you can watch it in the US. It's called Open Wide, and I go into really good history in there of how it started. But so I wrote this article, The Black Swan, in 2009. Then I started opening my clinic, and someone advised me to go onto YouTube. They said that it's a really good way of getting information out there. And of course, so I start just making, little videos on what's an overbite, what's an overjet. And of course, I'm itching to put out more complex information. And I then put up information. I realized that it's really boring giving the exercises I give.
Yeah.
People always want something really complex. They want something, tell me the secret. And I go, well, yeah, lips together, teeth together, tongue in the roof of the mouth. And build your chewing muscles up and stand up straight, okay?
Yeah. And when you swallow?
And then swallow without using the facial musculature.
Tuck your chin and...
Chin tuck, sit up, bite together, push your tongue up, don't use the facial muscles. It's in the Mewing app. Because it got so boring, I've actually gone and made a really good quality app that you can get, the Mewing app by Mike Mew. It's all there, it's all in it. Yeah. But it's the constant application of simple things. Yeah. So it's like
I find it the most difficult thing.
Well, everyone does.
Yeah.
Everyone wants a secret. They want a shortcut. Don't forget, medicine is cheating. Everything in medicine is cheating. Yeah. Didn't have medicine, would just die or be
I like
disabled.
to call it biohacking.
Whatever, but it is cheating. And, these are just different ways to cheat. Yeah. But what you're trying to do is you're trying to reestablish how we should have been in the past.
Yeah.
So I put some exercises up, so it saved my energy that people could just see these exercises. And then I was invited to give a lecture at the 21 something. If you type Mike Mew 21 into YouTube, you'll get the lecture. I was asked to give this lecture, the type of lecture that if I'd looked into it sensibly, if I did sensible background check on these guys, I wouldn't have done it. Because, they had pickup artists. I never knew what a pickup artist was, Yeah. Wow. That's, Anyway, And people giving bodybuilding tips and all of these things. So, I would have steered clear of it. We didn't have the term incel at the time. I have never heard of it.
Yeah.
But this was that community.
Okay.
And so I was asked to give a lecture, and the lecture was at Charing Cross Hotel. At the time, my wife was working in Covent Garden that was literally 100 metres away, and they timed it. It was perfect timing. Literally, I could give the lecture and meet her after work.
Yeah.
It couldn't be. It was serendipitous. So I just went, okay, I'll give the lecture. Why not? And they said they'd put it on the internet. They'd do a high quality recording. At the time, that's what I was lacking. I didn't have the kit to do that type of thing. So great, yeah, put it out there. And of course, I was itching to get you. You imagine having this information in your head. Imagine knowing this and no one else knows it.
Yeah.
And of course, there's so much more I know. So much more I have to give. Mewing is just this shadow. It's just this byproduct of the underlying problem. So I give this lecture, and I've given the lecture before, but I jazzed it up a little bit for this particular audience. I've normally given it to dentists and orthodontists. And at the end of the lecture, I went to collect my computer, and the table was surrounded by people. They were 3 deep all the way around me. And they were saying, well, how can we make ourselves better? And I go, well, you'd be crazy to try because it's just so difficult. Okay, it's simple, but the simple application of the constant application of simple things is difficult.
Yeah.
If I could just say, just work a bit harder and do this, and you become successful. Simple, but it's when the push comes to shove, you can't be bothered half the time.
Yeah.
You get lazy.
Of course.
So it's a simple the constant application of simple things. That's what we're doing here. So I was surrounded by these people who were saying, what do we do? And I said, well, you'd be crazy to try. But on the other hand, you'd be crazy not to. Because what else are you doing with your mouth? Most of the time, you should be able to have a suction hold. The tongue sucked to the roof of the mouth. It should be effortless. You should be standing up straight. It should be effortless. And if you've got near enough to the correct structure, you should be able to make this effortless.
It doesn't matter how old you are.
There we go. Can we come back to that neuroplasticity?
Yeah.
Yeah. Now, is it your neurons that aren't plastic, or is it because your structure's the wrong form that it's uncomfortable to do it?
Yeah.
Which? Okay? I don't know. But I know that if you have a stroke at any age, your face drops at about the same rate.
Yeah.
So we know that the wrong change will happen at a very similar rate at any age. So why couldn't the correct change happen at any age? This is what we need to explore. The problem is at the moment, everything I've tried to do on my own, by myself, against great resistance. Okay, if I mess up, I'm for the high jump, as I'm finding out.
Yeah.
Whereas really, I'm paying my taxes, so my patients, they pay for a group of full-time paid-for researchers. I've approached my local hospital it teaches 25% of all the orthodontists and dentists in the country. It's about a 20-minute journey door to door, approaching them saying, look, just look at my results. Just engage with me. Just have a discussion on any level, on any subject, at any time. Where's the camera? Any orthodontist watching this, I'm open for any level of discussion at any point, anywhere. Just phone me up. I want discussion. That's the lifeblood of science, isn't it? Discussion. And that's what I want. I just want debate. I want engagement. I'm starting with the cause if you don't understand the cause. Because that way we can start finding these answers.
Yeah. So, and what happened after the lecture?
Oh, sorry, okay. Back there. So I gave his lecture. And with the time we had a Google alert. You can put these alerts out on words, if a word's used. So we had an alert workout on Mike Mew. Mike Mew, nice little short, simple name. And all of a sudden we see alerts coming in. And people on some very strange forums, some very, toxic, I think it's the word. You get some toxic forums. They were talking about this. And of course, me desperate to get the word out. So I went on to some of these toxic forums and I engaged with these people and I started so I would take questions. I'd just be fielding questions from these toxic forums. And then I would do a little video giving them answers back. And then more questions came in and I gave more questions back. And, well, here we are now, mewing. We checked the other day on TikTok. The hashtag mewing is getting 100 million hashtag views per day.
Wow. 100 million per
day.
That's quite insane.
I had a patient came in from, well, first of all, so we had a 50th wedding, 50th birthday party of a friend of mine. And a friend came from Ireland and he said, hey, Mike, all the kids, you're the hero. Everyone at their school is mewing and they all know you. They all said to say hello. Friend comes down from Bristol, same story. Then a patient comes over from Latvia, same story. All the kids in the sort of 16 to 25-year-old category, they're all mewing. The penetration apparently is near 100%.
Wow. Well, that's quite insane.
So
what is actually mewing?
Well, it's a tropic premise. Lips together, teeth together, tongue on the roof of the mouth, added with strong chewing muscles standing up straight.
Yeah, okay. So they've been practicing that and doing like are they pushing with their tongue?
No, this is confusion. So, I've removed half the reason, well, a good chunk of the reason I've done the Mewing app. So the Mewing app by Mike Mew, all right? You can get it on the Android or the other one.
iOS.
Exactly. That's there to teach you to do it properly because I was worried. Number of people sending me messages saying, oh, I've had this terrible problem because I've been pushing my tongue. Well, why are you pushing your tongue? I never said that.
Yeah.
Well, what are you doing? If you're going to push your tongue all the time, whoa, what problems could you cause? No, it's supposed to be held there with suction.
Yeah.
And then that's effortless. You can hold, as long as it keeps your lips sealed, as long as you hold your lips sealed as the seal at the front, you should be able to maintain a vacuum standing up straight all the time. So, that's what I'm saying. It's good posture.
Nothing else.
Nothing. It really is good posture, but there are certain secrets. And of course, understanding the back third of the tongue. I went to see Angela Kane. She ran this thing called the Voice Gym, and a light bulb moment when I realised what the back third of the tongue is. When I engage the back third of the tongue.
How do you engage the back third of the tongue?
You've got to get the hyoid. It was going to take me about 20 minutes, half an hour to really explain it to you. So that's why it's on the Mewing app, because and you can't see anything. It doesn't translate in video or it's
because
really
you have to do it with your mouth shut.
Exactly. And then you can't see anything in. I've tried to explain to someone in a kind of like amateur podcast. It didn't work. So let's not go there.
Okay.
But as it's called the hyoid lift. As I raise my hyoid up, the power of the hyoid kicks up here and it pushes you into better body, neck, head pose, and then it maintains it. So if you see my hyoid going up, you see I can hold, but you naturally want to hold better head posture. Yeah. So I just suck my tongue up, hyoid goes up.
Yeah. And you just keep it like that.
As long as you keep the suction, you stay there.
Yeah.
And of course...
Oh, so you create like a vacuum.
You create a vacuum in the mouth.
Okay, yeah. I understand.
But you've got to have enough space to get your tongue up there. Yeah. Because, of course, we do two compensations. Because we lack space, we have a forward head posture, and then we put the tongue between the teeth, often with the mouth open. And that makes, because you've had a reduction in cross-sectional area, and you want to breathe.
Yeah, it's weird that actually you breathe easier through the nose.
You should do. Yeah. Depends what your nasal structure is. Depends how affected you are.
Yeah. So I have no idea how affected I am.
You're less than most.
Yeah. Well, I have a stuffed nose right now because I've been sick 2-3 days ago.
Yeah, but
so it's not a regular situation for me. But
yeah, but you just see. I saw some research by including a friend of mine. Mariner Evans, where they looked at just pre-industrial skulls, and the width of the nasal complex is just, it looks like those pre-industrial people were different species from those post-industrial. That's us.
Really?
And you're definitely post-industrial. You're better than average.
Yeah.
But if you're having any signs of a blocked nose, you've got problems.
Yeah, because you know how I noticed?
You should have such a wide nasal capacity. You never, ever, ever get blockage.
Yeah, well, the when I noticed the problem was when, you know, doing these breathing exercises, and most of those exercises, I mean, almost all of them, if not all of them, practice breathing through the nose and exhale through the mouth. And, you know, there's a different ways you exhale, like not changing the atmospheric pressure, just releasing the air like a little, I think the balloon, you know, fill balloon the air out. But breathing through the nose, and once you advance in exercises, and there's like more vigor, more intensity with breathing in, you know, feeling the capacity of from your abdomen, from your lungs, and so on. It turns out if you want to do that in shorter amount of time, it turns out I have to I have to open my mouth a little bit and help breathing in, because I cannot take enough amount of air in such a short time only through my nose. It just doesn't have enough capacity. I mean, it feels like, you know what I'm trying to say?
Yeah. Well, yes. I mean, there's
if I want to follow through the exercise, I have to open my mouth a little bit and help.
There's so much contradictory information on this, and of course that's why we really need science. And of course, I think that you've got one situation that there are different situations for different times. You know, we know that eating little and often is the perfect antidote when you're recovering post-surgery. However, we also have good evidence to suggest that intermittent fasting can be very good for you. So clearly these are at different periods at different times. You know, you look at the work of Konstantin Buteyko with the Buteyko breathing, and he's saying that we need to breathe less, slow right down, build up our carbon dioxide levels. He's suggesting that one of the great causes of allergies is the fact that we're breathing too much. We're blowing off our carbon dioxide. That's changing with the Bohr effect. That's having an effect on how the oxygen's released peripherally. It's also changing the pH and blood biochemistry, which he feels is leading to allergies. Okay? So that's the fact. There's a whole. We don't need to open that Pandora's box.
Okay,
we will be there all day.
Because everything I read and listened to suggests otherwise. Like
I know, but I think this is the same situation, that when you're in the normal day-to-day running of the system, you should have higher carbon dioxide levels, minimal breathing, absolute low breathing. And then, periods of time, you need to be able to burst and do absolute heavily breathing. So I think that it's very difficult to draw a sort of one brush fits all times.
Yeah.
So I definitely really, Buteyko puts me some really good stuff, and I totally buy into that. And yet also does some of these other breathing experts put in some other good stuff. I often think they're not asking the question, why? Why are we breathing badly? Well, I would say that often we've had periods where we've had to use too much muscular effort, too much chest work to breathe, because we were struggling to breathe because our structure wasn't good. And that's the big open question of all of these breathing guys. None of them are asking the question, why are we breathing badly in the first place?
Yeah.
So that why. I remember meeting a German engineer, and he said, yes, we must be taught. We are asked to ask the question, why, 6 times. You give me the response, and I'll say, why is that?
Yeah.
You give me the response, I say, why is that? And they do it 6 times. I wish medicine would do the same thing.
Yeah.
You know, one thing, we sit in this little speck of nowhere in the universe. And when we look at what we know about the universe around us, it defies logic. Defies logic at how much we know. Now, we've done this in combination between experimenters, observational experimenters, and philosophers. So you have we have the astrophysicists who just philosophize, and astrophysicists who do experimentation, and they bounce off each other. Okay?
Oh, yeah.
In medicine, where are the philosophizers? Where are they? We have no philosophy going on. No one's sitting there trying to answer basic, simple questions. We just have experimenters. And experimenters come up, and you read the article, the abstract, and the conclusion.
Well, you do have now a holistic approach in psychedelic treatment where they use philosophers.
Well,
because you're going through existential crisis.
Galen, what you're suggesting is that there's new areas of medicine where we're getting people philosophizing. Yeah. Exactly, that's where we should be. That's what we need. We're just lacking philosophy. We're lacking people sitting there talking about it. And of course, what I would really like to see is where we have this the philosophizers, the experimenters, and the patients.
Yeah, because now also you have a huge trend in psychiatric and treatment, and in psychology treatments also, that philosophers are entering this, and you now have this existential psychology going on, and it's a quite big wave.
Yeah. I mean, it's not
philosophers becoming psychotherapists.
Certainly not my area. but we've got this right now. All right. So Karl Popper wrote the philosophy of science, and he was the one who put forward the null hypothesis, and he was put forward, the article I wrote in 2009, the Black Swan. Yeah. So he made this question, the Black Swan, that he said that if you work, and this is empirical science is how we move. Kind of what medicine's been based on is empirical science. And the problem with empirical science is that if you look around the world and you say swans are white, you can say they're always white. Have you ever seen, they're always white, aren't they? Every swan we'd ever seen was white until they arrived in Perth, Australia, and they found black swans. Yeah. Now, until that moment, you could have put forward the argument the swans were white. And from empirical science, that would hold true.
Yep.
So he put forward the concept of the null hypothesis. He said you couldn't prove anything. Now, another philosophy he had was on the communication of science. He who holds the power of communication within science holds the power of science. What are we doing right now? Are you a scientist?
No.
Okay. 30 years ago, could we have done this?
No.
Okay, so now we've changed the communication of science.
Yep.
Yes. So we're pushing back science. We're changing science. Now, anyone watching this, ask yourself, do you watch other podcasts? Do you watch other videos on YouTube about health? How are those possible? Because the communication in science has changed. Social media has changed the level of communication, and hasn't that been an eye-opener in medicine in so many different directions?
Yep. And now this circle us back to mewing.
Aha.
The mewing
Good
phenomenon.
segue.
The mewing phenomenon.
Yeah,
mewing
that
effect.
was, yeah.
And then, but with the things I've seen online, it's not just, having the oral posture, body posture, keeping your mouth shut, lip sealed, tongue on your roof, on the upper arch. It's not only that, but I also saw some exercises, people chewing something to restructure their jaws.
Well, yeah, there's a whole plethora of devices and bits of equipment have come up, as they would. So when I started the mewing, I was explaining that it became popular, and then, suddenly I saw images. You had Vlad from Vladivostok, and you can see his before and after photograph, and you see this kid with literally no chin. And then you see him a year or two later with this chiseled jawline, and he says, "I've been chewing bricks." And I just look at this facial change and I'm gobsmacked. Even me knowing what you can achieve, I'm gobsmacked. And then there's another photograph and another photograph and another photograph. And you can see now you've got a movement that has legs because people are individually getting changes. And they're using a load of crazy equipments and ideas and face pulling and they're thumb pulling. They're engaging so many different techniques and methods, and then people are making some of the products were already out there because I'd love to look at this.
Yeah, but that's how I heard of you.
The Jaws and
that's how I've heard of you for the first time.
And yeah,
because they've been talking about you like on Huberman podcast, on Joe Rogan podcast and stuff, and then they were showing like these extreme examples of like overdoing it.
Well, but okay, it's 2 points here. First of all, we really need to get the we put in the spotlight of modern medical research into what's happening here, because these kids are doing experiments on themselves. Some good, and I'm sure some bad. Okay, we need to be creating an environment that's unlike what we've done before, because there's new science here. I want to encourage these people to come forward so we can understand what's happening. Okay, now the problem with the treatment method I was using was I wasn't making money. Yeah, I was losing money. So I had this great system my father bequeathed to me that was great. And effectively, I feel, in my opinion, I could take any child that's facial growth wasn't going well. Let's call it unhealthy. Some people would say that didn't look very good.
Form and function.
Yeah, form. Okay, yes, I know, but it's very uncomfortable to say they weren't attractive.
Yeah.
Okay, but let's say that they weren't. It wasn't a healthy structure, and I could turn that child into a fantastically healthy structure. So they looked better. All right?
How long would it take on average?
Okay, how long does it take to grow? Yeah.
Well, yeah.
You know, so you can understand how long I had to work with these patients, and they had to keep motivation, and they had to keep going, consistency, and you know, when they had problems, I had to be there, and they were. My phone was call phone central for all these patients for all their problems for a decade. Okay, so the actual intense phase was often 2 to 3 years. But when I looked at my books, how many times I had to see these patients, how many hours I put in, you can't make money doing that.
Yeah.
And the number of appliances I made. And then every year, you know, food was getting more processed. Parents were pushing their kids less. The kids were becoming more snowflake. Posture was getting worse. And where's my business model going? And then, of course, all of this action against me by the British orthodontists blows up. And, of course, I realised now I'm paying out more on court fees than I'd never made money. Yeah. I was losing money, actually. You know, only way I could make the treatment system work was by living a kind of student plus lifestyle, working next door to the clinic, working so hard it was burning my health. Yeah. And yet, you know, you had this method, it was fantastic. And I said, well, if only I could get that spotlight of modern medical research in to look at what I was doing. But of course, you know, if I got a 50% improvement in everything, I would get a 50% improvement of the alignment of the teeth. Well, the orthodontist would look to me and go, well, look, you know, Mike, you've worked on this kid for 5 years and the teeth aren't bloody straight. What are you doing? Well, I'll go, well, yeah, but I'm not making them straight. I'm getting the patient to make them straight. Now, that's a far harder proposition, but whatever they've achieved, that's more likely to be stable than what you've done artificially.
Yeah,
and of course
because they did it themselves.
Well, yeah, they're not themselves. You know,
they put it in the work.
Yeah, they put the work
and
in.
Became the part of their day.
And then you know, look at the face, and of course the classic.
It became a habit. Yeah,
The classic thing is, let's say you're a dentist, you're seeing a patient. The patient comes in, the teeth aren't perfectly straight. I mean, they're pretty straight, but, you know, but just not totally tied in. They've got all 32 teeth, but they're not perfectly straight. And you look at this patient and you go, well, crumbs. He's been seeing Dr. Mew for how long? 5, 6, 7 years? Teeth still aren't perfectly straight. God, this guy's an idiot. Clearly doesn't know what he's doing. And look at a beautiful girl as well. Now, he doesn't remember. She looked like the backside of a bus when she started treatment. She's now got an airway to die for, not to die from.
Yeah.
She is standing well. She is healthy. She is confident. She's got a great life ahead of her. The next patient walks in, yeah? Teeth perfectly straight. And the dentist goes, now that's what that's what a good orthodontic result is. Now, she's wearing retainers. As soon as she stopped wearing those retainers, teeth are going to go crooked again. And he doesn't remember. Her face looked great when she started. Now, maybe not quite so good. Airways, not quite so good. Life chances, well, let's not talk about that. So, you know, but the straight teeth.
So you're talking about prioritizing aesthetics.
I'm judged on the alignment of the teeth. And in that, I didn't do as well as if I'd put braces on and artificially forced them into position. So, where was I going? I was going nowhere.
Yeah.
I wasn't making money. And, well, I'm still doing it. I'm just taking on less and less cases. I'm gently winding back because it's damaged my health.
Yeah.
You know, it's damaged my finances, it's damaged my health. And I came to the conclusion, you know, I went down to South London, into Purley, and I took the conscious decision. I couldn't just, you know, all my peers have spent, you know, they're earning between £250,000 every year. They are driving fancy cars, having fancy holidays, living in big houses, you know, yada, 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 doing the thing. And I went down to Purley and I said, okay, I'm not going to make a great deal of money. I'm not going to go wild. It's never going to happen. But I'm going to do the right thing. I'm going to make people healthy. And hopefully, somewhere along the line, if I'm getting great facial outcomes, if I'm getting the best facial outcomes on the world, somehow it'll work out.
Yeah.
Fingers crossed, I'm going to make it work out. Okay?
Okay. Let's...
and it worked out in a very different way than I imagined. But I did the right thing. You know, I don't know. You know, again, I've had a charmed life in many respects.
And let's dive in then into this misconduct charges.
The Empire Strikes Back.
The Empire, yeah. The literal empire.
Oh, yeah.
Literal empire. So what happened? And
okay, so clearly
is it over or is it still ongoing?
No, clearly. So I've got to be a little bit cautious about what I say
because it's an ongoing case.
It's a live case, and so, however, it was first reported in May 2017. So my daughter, number 2, Zarina, was 1 year old when the case was started report, almost to the day on her birthday, around the 25th. So she's now about to turn 8. And her entire life I've been a stressed bunny. Right. You know, that annoys me. You can understand. Yeah. It's destroyed my finances. It's destroyed my clinic. You can't invest. You can't do anything. You can't employ people. You can't. What can you do with that hanging over you? And then you type my name into Google. What are you going to get? You're going to get all these newspaper articles basically slandering me.
Yeah.
You know, there's a lot of dentists. There's a big call amongst the dentists that our organisation, the General Dental Council, isn't fit for purpose. You know, a lot of dentists saying that. And I agree. When I was first qualified as a dentist, if you messed up and a patient had problems, there was sod all they could do about you because everything was in the dentist's favour. And it swung the other way. The pendulum has moved. Now it's all in the patient favour. Yeah. Dentists are muck till proven otherwise. And the General Dental Council is out there as a guardian body of the patients, and the dentists are guilty until proven innocent.
Okay, so what happens?
But while you're being proven innocent, you sit there with these allegations over your head. Nothing you can do about it. Nothing you can say about it. You know, we're questioning how many dentists commit suicide under this strain. And, you know, the British coroner is actually criticising the General Dental Council for making these allegations and pays dentists sitting there all this time under allegations. Now, few, if any, of the trials have gone on as long as mine. You know, that's, well, how many years? 7, 8 years.
Yeah.
This has been going on for. And actual court case, well, it's going to be the most expensive. It's going to be the longest. It's going to be the most complicated. It's the biggest. It's the everythingist court case in dental, probably even medical history in the UK. And, you know, this is mainly a philosophical debate. It's a philosophical debate. And you know what the key thing is in this? The etiology of malocclusion. Why are teeth crooked? That's the key discussion. Is it the environment or is it the genes? Well, funnily enough, I asked 4 separate heads of the General Dental Council for a debate on why are teeth crooked. Now, maybe if they'd had that debate, I wouldn't be here in this court case. Hello, wake up, smell the coffee. Allegations against me, well, they're allegations. The main allegation, this one that I called, I call seizures in a boy. That's not even one of the allegations. It's not there. Where did that come from? Well, that's this disinformation. That's a great way. You know, why? Why do that? Why have that over my head right now? Is that convenient? For whom? Who's it convenient for? Why was it said? And if it's not even in the charges, why is it in all the newspapers? What's going on?
Sounds like a smear campaign.
Well, it's not me saying that, is it? You just said that.
Yeah.
Yeah. You know, it's not in the charges, so why is it out there?
Yeah.
You know, the need to demonstrate that I harmed someone is so you mentioned I've been mentioned on Joe Rogan. You mentioned I've been mentioned on Andrew Huberman a lot, and yet none of them are going to interview me. Yeah. Why? Well, the first thing they're going to do is going to type my name into the Google. Type it, try it. Anyone listening to this, try typing my name. What comes up? Yep. Well, if me causing seizures on a child, you can go, it's public record, go to the General Dental Council. I'll give you the link if you want underneath this video, remind me. Those are the allegations. Well, there isn't an allegation in there of me causing seizures. So why is that on all the newspapers? Is that convenient or is that not convenient? Well, because I can't get on any of those podcasts.
Headline sells.
Headlines sell. Headlines paint a big tarred brush. It's effective. It's working. As I said, with Karl Popper, the communication The control of communication is everything. Now, the internet has given us wings. The internet helped me get Mewing out there. The internet's helping me. So Mewing, you're not yet, because we haven't actually started taking any money out of it. But the Mewing is finally going to give me some finances to start to do what I need to do, to get this research going, to find answers. This is my quest. You know, I'm really fascinated by all, you know, this whole thing. You know, meeting you, going on a proper podcast. You know, not one of these ones where I sit in my room in front of my
Zoom.
computer on Zoom. Yeah. Zoom. And, you know, this is my first proper one. Hello. Well done. Thank you very much for giving me the opportunity. But, you know, I want to do this. I want answers. You know, my thing is, I don't have all the answers, but I'm asking the right questions. Okay? And I want the truth. I want the truth, the whole truth, and no dogma. Because that's what we need. You know, and, you know, this is, I'm third generation. Hello? I want answers. I want answers. My father's 95. He's hanging in there. He's hanging in there to get some recognition for what he's been saying. He is the most maligned orthodontist, dental person on the planet.
Yep.
You know, you go to any British dentist, any British orthodontist, and he's a known charlatan. Oh, we know that. We know that. I say, well, why is he a charlatan? Oh, well, he just is. Why? Oh, well, we don't know. He just is. Is that lack of communication? Is that lack of debate? You know? You know, all people stand to lose is their ignorance.
Yep. Oh, well, sparking a good debate today is, you know, finding a good debate is not an easy find.
Yeah.
It's not an easy find today.
No. And then I take, and this is what makes my blood boil. You know, I'll go to pick up the kids from school, and I'm sitting there, and I can see the other kids coming out, and I can't help noticing. I can tell which one's going to die young. I can tell which ones are going to have ENT problems. Look up an adenoidal face.
What?
An adenoidal face.
Adenoidal.
Adenoidal face. You know? An adenoidal face is one of those faces that's just grown down. It looks like they've had a bilateral stroke. And the whole face has dropped down. And the ears have turned around. And you understand craniosacral therapy or cranial osteopathy and how they propose the bones move. And then you understand what changes would go on with the cranium to create an adenoidal face. The ears turning out would make complete sense. If they're right, maybe they are. But again, this is a group that is considered to be unscientific. But again, I think debate would open their doors as well. But if you can understand an adenoidal face, and you understand why they called it an adenoidal face, then, and you start asking questions around that, well, why was that called an adenoidal face? And where does sleep apnea fit in? And those are the types of kids with that type of craniofacial structure that are getting sleep apnea. And then you understand when we talk about the village idiot. Well, doesn't the village idiot look just like the kid with that adenoidal face? And why are they village idiot? And let's rewind to what I said earlier on about the 10-point IQ difference between the kids with and without sleep apnea. And then when you start seeing it, you'll understand that everything I've said today didn't require me to give you scientific knowledge. All I've done is piece together existing bits of evidence that you already know, and I've pieced them together in a way that makes sense, in a different way than you'd previously considered it. Well, that's eye-opening.
Yeah, in a way, yeah.
That's all I need to do. And that's all I'm asking for. I'm just asking for a full, free, and fair engagement. We need debate. You know, why can't we do this?
So in the meanwhile, you have your own YouTube channel.
Yep.
Yeah.
Orthotropics.
Yeah.
Orthotropics. So ortho means correct or straight, as in orthodontics. But orthodontics is correct, straight teeth, dontos, whereas I'm talking about correct growth. So I just want children to grow correctly.
Yeah.
Okay? My big thing is prevention. But I just want to find answers. And so I'm on this quest now to find the truth. You know, my two rules is I want to leave no stone unturned in my quest for the truth.
Okay.
I think often you find answers in places you didn't expect. And I don't want to work around. I worry about what the scientific medical community, they're turning their noses up because they don't want to look in places where truth may be. And the second is I'm going to be really open-minded and try and apply the scientific process. And of course, again, I just think your ego is the destroyer of science.
Yeah. Well, one question: Have you have you tried, entering some official research in order to, having some test groups?
Okay, yeah. So what we've done, my father had done quite a lot of bits of research. I mean, one of the famous things he did was he treated identical twins in different methods. So, and clearly that's been poo-pooed by the orthodontist who said, well, these are just individual cases, aren't they? And he's go, well, okay, right, this might not be perfect science, but it does give you a view. It gives you a window. And yes, it's not perfect. We've done several things. We've done quite a lot of little bits and pieces of research. But remember, we're doing this in everyday clinical practice. And it's really hard. As I said, I was getting home in the evenings exhausted, absolutely destroyed.
Yep.
I've got no spare cash. I'm living as cheap as I can. When am I supposed to do this research?
Well, I'm just asking. Have you ever applied for money for research?
Yeah. I've got I said
been denied what?
Yeah, so I wrote endlessly. I spent a 5-year letter writing campaign to my local university. As I said, it's not far from just up by London Bridge Station is the biggest dental school in the UK, and I've written to the professor of orthodontics. 5 years I wrote to him saying, come on, listen, you've got salaried researchers paid for by the state, by my taxes. Just give me a look in. Just come and have a look at what I'm doing. Just open a conversation with me, please.
And reply?
Well, basically no.
Yeah.
Basically, I've got better things to do. And
from
then,
all of them.
From all of them. And then when the action starts against me, I'm saying, okay. The problem is that I'm being told because I don't have adequate clinical evidence and adequate objective clinical evidence to support what I'm doing, that means I'm wrong. And yet you won't help me get adequate objective evidence. So hang around, this is a circle here. I'm in a catch-22. I can't get the evidence because you won't help me. Because I haven't got the evidence and I'm wrong.
Yep.
And there we go, you're hung. You're hung out there. And that's, medicine doesn't like change. There we go. So what else have we done? So I've asked for debate. And of course, I thought in the scientific concept that you were supposed to exhaust all the existing evidence before you start any research. Well, hang on, let's have that debate, that full, free and fair debate. We start with the cause of the problem and we work upwards because you need to know the cause, you need to know the epidemiology. I used to talk about epidemiology and no one knew what that was. Since COVID, everyone knows epidemiology.
Yep.
Then you need to know the physiology and the pathophysiology. So how are those processes going wrong? So I've put forward the concept craniofacial dystrophy, and reading some of the letters in response to me putting that forward is illuminating. Basically, people just shut up, go away. We don't want to talk to you. And I put forward this concept, craniofacial dystrophy. I'm saying something's going wrong with the facial form. This is my best guess analysis of the pathology of this process. And then we want a cure. We want people cured. I don't see, there's 5,400 species of mammals. I don't see many other mammals with crooked teeth needing orthodontics or needing retainers.
Yeah,
they all seem to be growing just fine. I don't see any of our ancestors having problems. It's just modern humans. And a face that ain't the right shape don't work properly. And there's, yes, crooked teeth, people like to have their teeth straight, wonderful. But there's more going on here.
Yeah. Have you found anyone from medical community having like an adequate reply to your,
they don't respond.
Your thesis?
They don't respond. Just don't respond.
Just ignoring completely.
Yeah, ignoring. Well, they're not just ignoring. They're clearly taking action against me.
Yeah.
Disinformation, legal action, And because remember, what I can say about the case against me, a third more of the case was a referral by the British Orthodontic Society itself. So effectively, my trade union has taken action against me by going through the videos, finding points they don't like, and reporting me in, I would say, and I'm going to go on record for saying this, in quite a heinous manner. So the British Orthodontic Society, my union, taking heinous action against me in reporting me to the General Dental Council with the almost explicit purpose of having my license removed in, I feel, what is an effort to shut me up.
Mm-hmm. Okay.
Fun. in it.
Yeah. So they're looking at your YouTube videos.
Oh, they are looking at them very closely. And I don't know, I mean, I wonder what they're thinking about this whole mewing thing. I mean, you know, so you go to the American Association of Orthodontics and you can see what they're doing in mewing. And again, anyone from the American Association of Orthodontics, please have a debate with me, you know? Because mewing, I mean, you know, mewing is effectively myofunctional therapy. And there's good quality evidence out there. So there's a meta-analysis from Stanford, you know, one of the top scientific institutions in the US, which is probably the top scientific country in the world, a meta-analysis on myofunctional therapy saying that it reduces sleep apnea symptoms in adults by 50%, by children by 62%. Okay, you tell me there's no evidence mewing's beneficial.
Well, as they say, it should be official. You know, it should be in a well-organized, you know, scientific research.
Well, that was
with double-blind control groups and stuff like that.
Okay, a meta-analysis is getting pretty close to that. I mean, we need a Cochrane research, you know, evidence to go further than that. But, you know, you've got a meta-analysis saying that this has, maybe we're not got to the level of saying it's going to influence facial form, but, you know, that's still anecdotal.
Yeah.
But if you're saying a meta-analysis with kids, 62% improvement in the symptoms of sleep apnea, well, that's mewing, isn't it?
Yeah.
That's evidence for mewing. That's good evidence for mewing.
So what's your plan to fight this and, you know...
Well, I need to get...
Keep your head above the water.
Yeah, I need to get this court case out the way. I need to clear my name because I need to move forwards. And what we need to do is we need to help kids. And I think one of the reasons I'm here in Belgrade is we want to set up a clinic to provide... We want to wake up some other old appliance systems. So I want to draw from the work of Frankel, who was working in Eastern Europe, where, you know, there was a lot of hardship is it brings forward innovation. Problems helps innovation, you know. And Frankel had some great ideas. He really did in helping train people. And so we want to reawaken some of these ideas. We want to run a little clinic here in Belgrade. And we want to try making appliances, physical appliances, which we want to combine with body posture, body functional work, and mewing to help people. So we want to open a clinic here in Belgrade to help children change, assist them.
So have you had experience with some of your patients doing all these three things, like mewing, some appliances?
What I've been doing, we haven't quite put this
all of those things together.
We've put two of these. We've put appliances and mewing training together, and I want to get more into the body posture work. And I got this opportunity, this unique opportunity here in Belgrade, and in part because it's not London. Apart from, I'm out of the hassle and the spotlight of what's going on in London. So we've got a unique opportunity here in Belgrade to put this together and to bring out some of the work of Frankel, some of the work of some of the Naudi and some of the functional patterns work, and some really, you know, some intuitive mewing work together. So we're looking at sort of young children, sort of the under 8 category, the early treatment category, and then I want to go into the slightly older category, the sort of 16 plus category, and we're going to raise interest. We're going to start this clinic where we're encouraging people to come forward who have a display of interest, to come forward and to register that interest and give a little bit of information about yourselves as well so we can register you. And, you know, start unwinding the clock. I'm not saying I'm here to give you perfect straight teeth. I'm not here to get dramatic changes in craniofacial structure. I'm here to start helping you to change yourself. And that's a very different way of looking at it. You know, we've got this problem. Acute medicine, we've really licked. If I walked out on the street and I got hit by a bus, I'd want an ambulance to pick me up. I'd want anesthetics. I'd want antibiotics. I want all of what modern medicine's got to offer. And I don't knock modern medicine. It's brilliant. But if I've got a chronic condition, so I've got diabetes, I've got rheumatoid arthritis, if I've got sleep apnea, if I've got any of these chronic conditions, well, it could be argued that we're struggling.
Yep.
Could be argued we're struggling with chronic disease. And maybe some of those chronic conditions are related to the way we're living, how we're living. And it's you that's got to change. I'm very involved in the ancestral health movement in the US and in the world. And the ancestral health movement is just looking at the difference between how we live today and how we lived in the past and what that can inform us about health and what we need to do to change. And so what many of these modern chronic problems are related to modern lifestyle and changing lifestyle. If you're obese or if you're unfit, what are you going to do? There's no pill for it. Well, actually, we were starting to get pills for obesity.
What's the name of this latest one? Ozempic or something like that?
Okay. So I'll have to correct myself. Yeah. Maybe we'll get some. We're maybe going to cheat on this one, aren't we?
Yeah.
Go back to our cheating. But if you're unfit, what are you going to do?
But nothing's going to really help you as much as, actually getting in shape.
And also eating healthy, being healthy, being fit.
Because it's a holistic approach. It just changes so much about quality of your life.
Here I'm talking facial fitness. If you want to get facially fit, we're going to help you. And that's the idea of this clinic. Help you get facially fit. Yeah. So, you can do mewing, you can do these exercises, but is there an appliance that will help that as well? And so we're going to draw on the work of Frankel. We're constructing appliances. We're going to help you forward. We're going to use technology to its highest level. Because just as I thought, as I moved down to Purley and I thought, right, I'm going to dedicate my life to doing the right thing, in comes technology and it saves me.
Yeah.
In comes technology and it gives me the wings.
But it's a double-edged sword.
Oh yeah. Oh yeah. Where I'm accused of causing insecurity in children and young insecure men. Oh, am I? Maybe I am, and I'm sorry. I'm sorry to all those kids that I am causing insecurity to. I'm not intending to.
Yep.
I'm intending to help so many ways and help push back this Pandora's box, this new universe we've opened, this new door I've opened. Yes, there's pros and there's cons. There always will be. I don't do magic. I help people do hard work. In many ways, I'm no more than a glorified personal trainer with some good bits of kit. But I've got those kits. If you want the kit, we've got it. We'll help you. All right?
Yep. That sounds like
So my last comment here. Yeah. Okay, rounding off. If you were in the Matrix and I could plug into the back of your cerebellum and I could reprogram you to sit up straight, chew hard food, have good posture, do those right things. That is all I would have to do.
Yeah.
But wouldn't life be so easy?
Yeah. And I would like, to learn Kung Fu like you.
Yeah, exactly. I could upload French.
Yeah, some languages and maybe some Kung Fu.
Put it in there. Fantastic.
Well, nice meeting you, Mike.
Pleasure.
Thank you
for my first proper podcast.
Yeah, thank you. Thank you for being here.
Maybe the first of many.
Yeah,
maybe I'll have you on one day.
Well, maybe one day. And I wish you luck with your court case, of course, and all of your future endeavors.
Yeah, and then I want to shout out for the app because it's by earning money, I'm afraid. I'm English, we didn't talk about money.
Well, we'll put all those things we spoke about in the pin comment.
Pin comment, because I'm going to do, by raising money, I'm going to change the world. Hello? I'm going to make the world different and a better place.
Okay.
Facially fit. Thank you very much.
Thank you very much.
And prevention.
Prevention, of course. Thank you. That's it. Bye.